We also have to mention that we have a large group from colon, lung, and all this. We have over 100 patients, but we have a couple of people with a very, very rare tumor type, Klatskin tumor, anaplastic xanthanocytoma chordoma. So these are very rare, only 1 or 2 patients we could see, and we can say that in that case we also could see the efficacy of DDW. So what can we offer for the people regarding the DDW? If someone is dedicated for surgery and it is possible, we suggest to consume deuterium depleted water before the surgery, because that can help the people and the operation. We saw that the tumor is decreasing, and all these part of the tumor is coming back, and the tumor is getting close to the ball shape, so it's much easier to remove all part of the tumor. This is which would be interesting to see in an animal model, the radiotherapy combined with deuterium depleted water. We have seen several times that radiotherapy was given, hoping that the tumor will be a little smaller, but at the end there was a complete remission, and the patient was tumor-free after that. So we see that somehow that the strong effect, which has strong apoptosis, induced the radiotherapy, and the DDW can even enhance this process. We have seen, so with I mentioned the prostate cancer patient, we saw very, very good combination, the hormone therapy and DDW, and we don't believe that when we got that good median survival time, this is due to only the DDW. This is a combination of the hormone therapy and DDW treatment. And which is very interesting, of course, there are very, very good anti-cancer drugs for today, which were planned to inhibit certain kinases. And in that case, we see a very, very synergistic effect between DDW and these drugs. For example, the IRASA, we have a patient, and that patient was published in Clinical Oncology, who were treated with IRASA because the lung cancer and brain metastasis, and there was a complete remission. That patient were consuming deuterium depleted water, and I think the reason that the complete remission occurred was because she was consuming deuterium depleted water. We have patient with chronic myeloid leukemia. She was taking Gleevec, and she is in an excellent condition. Or the Herceptin also showed very good combination with DDW. So we can propose that if someone I diagnose with DDW, there is a time period between the diagnosis and the start of DDW treatment. So those who are lucky and know about DDW can start right after the diagnosis. Those who are not so lucky or they don't have any information about, they start it later. Of course, the earlier we can start, the better. And after the diagnosis, start of the conventional therapy. And hopefully, if everything goes well, there is a time when there is a complete remission. We suggest people to consume DDW even after the complete remission for a period of time. And after, we suggest a short break. At the beginning, we suggest 2-3 months break, and then start to consume again DDW. And the next break could be longer, and start again. And if we follow that for 4, 5, 6 years, at the end we can say finally these people are cured. And we believe that if we can combine and we can integrate the deuterium depletion in the oncotherapy, that will dramatically increase the efficacy of the treatment of cancer patient. So we say the 3 months long DDW treatment is a minimum time we have to apply to exert the effect. We say that the successful Peros application of DDW requires at least 3 months life expectancy. The integration of DDW into the conventional oncotherapy can result in a 2-3-fold increase in median survival time. In the group of regular users, the death rate was extremely low, the survival was extremely long. So that would be the final conclusion. Thank you.
Is anyone wishing to make some comments, questions?
Nice.
Well, if not, it seems that it has been the last presentation for today.
Okay.
I leave Dr. Schomle to continue.
Okay. Okay, so I would like to say thank you everybody for the speakers come from Hungary or abroad. I would like to say thank you the organizers. I would like to say thank you my colleagues. I am very happy to close that meeting. And I do hope that we will meet soon, next year or whenever, and we can continue our discussion and to show more results, and we can involve more scientists, and finally that treatment will be part of the oncotherapy. Thank you very much. Okay, you are welcome to eat and to drink, and we can continue our discussion outside.